The life of a Karamojong depends mostly on domesticated animals, especially the cow, which to them acts as a bank and without which they cannot survive. But the Karamojong have for a long time relied on traditional herbs to treat the cow, which method they say has been all guesswork.
We have been struggling, we ourselves, as we have been trained. We didn't have any capacity or money for beginning, but we are doing with our traditional local herbs for treating animals.
Although the herbs were helpful in treating worms, their behaviors have diminished due to the destruction of trees and are now relying on the scientifically approved medicines. Trained in 2011, the community animal health workers in Nakiripirith district acquired the skills with startup kits to provide veterinary services in the villages and are already treating and saving the life of mainly the cow that provides the Karamojong a livelihood.
Since we have been trained, at least we gain some knowledge and skills to help now the community. But those years back, we are having no money, at least, to buy enough drug.
But what is surprising is that initially, Karamojong women were not allowed to own or even touch a cow, but now the trend seems to have changed. Women can now own or co-share cattle. These animal health workers are now proud of the business, which they say is earning them a living, as they can purchase and sell these drugs, now on the increasing demand by the pastoralists in the area.
Every day when we sit now selling, waiting for the customers now to come, with people recording. But when we total, because we have allocated ourselves now at least three in a week. This is now the second week for the second group. Instead of one person to be there, all of us, we need to get experience.
They want their leaders to ensure that the vaccination of the cow is done twice a year and should lobby government to recognize and support them successfully carry out the duty in the villages. The major challenge for them now is the coverage of the large areas with huge crowds that they cannot access easily due to lack of transport like bicycles and coolers for medicine to avoid exposure to the sun.